Julia and I's research study is titled The Use of AI in Interpreting Cartoons. So, our project is going to look at comparing the ability of AI systems to accurately interpret cartoons. So, our project wants to explore the use of cartoon based tasks to assess social scenarios such as theory of mind and compare how well AI systems, neurotypical individuals, and individuals with traumatic brain injuries interpret these social scenarios through cartoons. So, we aim to evaluate the interpretive accuracy of AI in comparison to human participants with and without cognitive impairments. So, hopefully, this research may offer insights into both clinical assessment tools and AI's potential role in future cognitive evaluations. The first article I'd like to talk about is called Neural Correlates of Theory of Mind in Children and Adults Using Katoon, Introducing an Open Source Child-Friendly Neuroimaging Task. So before I get into this article, I just wanted to address theory of mind, or TOM, which is actually the ability to understand and infer the mental states of others, so their beliefs, their desires, or their emotions. It helps us predict how people might behave, respond, or feel in any given situation. So, for example, if a friend is upset because they lost something, it tells us to respond with empathy or support. So, the neural basis of theory of mind has been studied in adults, but there is still a significant gap in the research when it comes to children. One major reason may be the lack of age-appropriate tasks that can be used in neuroimaging studies, especially ones that keep children engaged and can accurately assess both their cognitive and emotional sides of theory of mind. So to address this, Borbis and colleagues developed a new tool or cartoon called Katoon, which stands for Cognitive and Affective Theory of Mind Cartoon Task. So it is an open source and fMRI compatible task designed specifically for kids, non-readers, and adults. It is engaging. It uses cartoon style visuals that are appealing and accessible even to children who are not able to read fluently yet. So Catatoon is comprised of 3 parts. It has the cognitive theory of mind, which focuses on understanding others' thoughts or intentions. It has affective theory of mind, which relates to understanding emotions. And then it also has a control condition that uses physical objects of the cartoon. So the entire design was made up through review of theory of mind and neuroimaging literature and created specifically for young children in mind. This research article is actually comprised of 3 different studies with their own investigative question. So for study 1, it was comprised of 60 participants, ages 3 to 9. This used the Katoon task only, and it asked the question, at what age does theory of mind actually start? For study 2, there's 27 healthy young adults, and it used the Katoon plus fMRI imaging. They wanted to assess the effectiveness of Katoon to activate different brain regions during theory of mind processing. The third study had 33 participants ages 7 to 13, and this also used the Katoon task and fMRI imaging. For this one, they wanted to evaluate the differences in brain activation between children and adults during theory of mind processing. So the Katoon task had cognitive theory of mind, which was understanding others' beliefs and intentions. It also had affective theory of mind, recognizing other emotions, and it also had physical causality, or the control condition, involving non-physical events. So on the right here, you can see it starts with cognitive theory of mind and then goes into the affective theory of mind cartoon, and then lastly the physical cartoon. Each scenario was also followed by a question or questions requiring participants to choose the most appropriate outcome and assessing their theory of mind abilities. Results of Study 1 indicated that children as young as 5 years old were able to perform the Katoon task. Study 2 results confirmed that Katoon effectively activated known theory of mind related brain regions. And Study 3 indicated that children engaged the same theory of mind related brain regions, but with less intensity than their adult participants. So, this study is particularly significant for future research involving individuals with neurological trauma or disorders. So, the use of cartoon based tasks like Katoon offers a promising and accessible way to assess social cognition in individuals with brain injuries who may experience language difficulties or difficulties with social cognition. So, by validating these cartoons in neurotypical participants, like in this study, it allows future researchers to apply and adapt them in a clinical setting.
So, the second article that we will be discussing is titled Exploring the Performance of ChatGPT-4 in the Taiwan Audiologist Qualification Examination Preliminary Observational Study Highlighting the Potential of AI Chatbots in Hearing Care. So, this study focused on assessing the performance of AI chatbots such as ChatGPT-4 in providing answers and reasonings for the 2023 Taiwan Audiologist Qualification Exam. This exam is typically taken by audiology students who have either a bachelor's or a master's degree, and those who have 6 months or 375 hours of clinical practice. And the exam consists of 299 questions covering 6 different topics in the audiology field. This study used ChatGPT-4, which is a multimodal large language model trained and created by OpenAI, and it has the ability to solve problems with greater accuracy due to its broader knowledge and better problem-solving skills that were implemented during its creation. The study used the 2023 Taiwan Audiologist Qualification Examination, and the researchers provided the ChatGPT-4 system with the 299 questions present on the exam and included the 7 pictures with 13 correlating questions that the AI was required to analyze for information before providing a response. A standardized prompt was engineered to be used in this research, which stated, "Please answer the following multiple choice question as a hearing care professional providing reasoning and explanation." Each of the 6 subjects were presented in a separate chat, and questions presented as images were provided in both the image and text format of the question. When looking at the data analysis for this study, it was completed in Excel to calculate the accuracy rate of ChatGPT-4's responses. When moving into the results section of this study, ChatGPT-4's performance was 75% accuracy across all 6 subjects, which is deemed as a passing score based upon the Taiwan Audiology Qualification Examination standard score of 60%. The researchers determined after a detailed review that the errors in ChatGPT-4's responses were caused by information errors, and the system was relying on inaccurate information when formulating its responses. A strength of this study is confirmation that AI systems have the current ability and expanding potential to provide logical responses to provided questions, as well as the ability to analyze images and provide responses with 62% accuracy. While this current study does not provide results of various image quality, which would be considered a weakness, it does give insight to the potential of the ChatGPT-4 system by way of images of suboptimal quality. The third article that we'll be discussing is the applicability of machine learning technique in the screening of patients with mild traumatic brain injury. So in this study, researchers worked to evaluate the applicability of machine learning to screen patients with mild TBI that came into the ER. And they used developed computational models to predict which patients with a mild TBI diagnosis are recommended to undergo a head CT. And their goal was to improve efficiency of patient time as well as use of machinery. So it's also important to note that machine learning falls under the umbrella term of artificial intelligence, but it does require more human intervention to train and it's unable to correct its own errors. So a human would have to be watching it to catch errors um, and correct them manually. This study was an observational, descriptive, cross-sectional, and retrospective study using developed computational models. The initial dataset included 2,287 patients who were over 14 years old with a Glasgow Coma scale between 13 and 15. But after excluding patients with a previous hospital visit less than 1 week prior, the remaining observations consisted of 1,851 patients. There were 10 variables selected for machine learning prediction model development based on their reliability and association with intracranial lesion occurrence, and 6 machine learning models were evaluated to identify individual switch head CT findings among patients with mild TBI based on physiological characteristics as a predictor. The data selected was divided into a 70-30 train test ratio, 70% training, 30% testing, with missing values being inputted 10 times using the package multivariate imputation by chained equations into 3 tree-based systems and 3 non-tree-based systems. The study concluded that the XGB model, which is the linear extreme gradient boosting non-tree-based model, was the best of the 6 models created during this study, with an accuracy level of 70% for detecting individuals with mild TBI. The model has a high potential to be used in screening patients with TBI after continued refinement, and this is a strength of the study as it shed light on the practical uses of artificial intelligence in TBI care and shows that with refinement, AI can be a useful tool in both improving the quality of care and the efficiency of treatment and use of resources. The use of machine learning is a weakness of this study because, as previously mentioned, it is a subset of artificial intelligence, but it's unable to learn from its mistakes and requires more human intervention.